computer. Okay, so we are now recording a interview with your clinic, and I'm going to give you the floor, Brice. So take it away.
Yeah, thank you for having me. So I'm Brice Millara from Beike Biotechnology. We are a Chinese biotech company. Originally, the company started in 2005. The chairman is Dr. Hu Xiang, is a Chinese gentleman who got his PhD in Canada about molecular biology and biochemistry. He came back in the early 2000s to start this company. And basically, we mostly, since 2005, we've been doing research. So stem cell research, clinical application, and stem cell banking. Since 2005, we've been mostly cooperating with Chinese hospitals to provide our treatment protocols, basically because we are not directly a hospital. And about 10 years ago, we actually, our department, which is the international department, we are in charge of dealing with international patients. We moved our operation basically to Thailand. So basically now the stem cell treatments for CP are available in Thailand. So the company itself, our company itself, basically we have, in China, we have 6 laboratories. We have 500 employees. Like I said, we are doing a lot of research. So we have more than 100 papers, clinical studies and clinical trials done in China. We have 5 or 6 studies for CP specifically. Those studies are about umbilical cord derived stem cells for cerebral palsy. In those studies, we've been using 2 different types of cells, umbilical cord mesenchymal stem cells and umbilical cord blood mononuclear cells. And we are using those 2 types of cells basically to treat CP patients clinically. In Thailand, we work with a clinic in Bangkok, basically. This clinic is neurodegenerative rehabilitation clinic, which means that they do a lot of rehab for patients with neurological conditions such as CP. And over the years, we worked with them for 10 years. And we have a very good cooperation because their program and our program together is basically, we think is a very comprehensive program for cerebral palsy. So
can you explain what that will be like? So if, let's say I have 2 parents here in the crowd, they have children with CP. Can you explain to these parents, what would it look like if they would come to your clinic?
Okay, so first of all, I will explain even before they come to the clinic. So what happens is that we have patients from all over the world coming to us, basically contacting us. And what we do, first of all, we review the medical condition of the child, and we do it online at first. So we have an online medical form that families can fill out. And there will be a back and forth basically between the doctor and the family until we get all the information we need to figure out if the patient can be accepted or if we cannot treat the patients there could be some reason that prevent us from treating the patients. If the patient is accepted, basically, the patient goes to Thailand, and in Thailand, there will be about 3 weeks treatment protocol that will be provided. So the families basically have to go to Thailand and have to stay there for 3 weeks. Let me show you my screen, and I will show you an example of treatment protocol, and I will explain at the same time. 1 second. Put it here. And share screen. Okay. Okay, can you see my screen?
Yes. I can see your screen.
Yes. Okay, so that's a typical treatment plan for CP. It doesn't mean that the treatment plan will be exactly the same for everyone, of course, because depending on the symptoms of the patients, it may be slightly different with certain therapies that will be provided, others may not be provided, but that gives you a good idea. So basically what happens is that we have a treatment protocol that lasts 3 weeks. And during those 3 weeks, from Monday to Saturday, patients will have different types of therapies. So you see, let's say that they arrive on a Sunday. On a Monday, the next morning, there will be an initial consultation with the doctor, where we will summarize the condition of the child. And the doctor will also ask the family what are the symptoms on which the family wants to work the most, basically. So maybe the child has some difficulties to hold his head, and maybe has some difficulties to hold objects and to swallow, for instance. And maybe hold objects is the most important for this specific family. They would like their child maybe to be able to grab a cup and be able to drink by himself, for instance. So then we will be working on the fine motor skills in the hands and the swallowing. So after this initial consultation, basically, there will be a physiotherapy and occupational therapy consultation, where we will basically see what the child can do and cannot do, and we will establish the program based on that. Then every day, there will be different therapies. So you see, there will be acupuncture, there will be physiotherapy, occupational therapy, aquatherapy is part of physiotherapy. It's physiotherapy, but not on the ground, in a swimming pool for patients who cannot walk, don't have enough strength to walk, but may be able to walk in a swimming pool. So we have a swimming pool available for them. We also have hyperbaric oxygen therapy, which is a therapy that helps to provide more oxygen in the patient's system, and that also help the stem cells basically to function better. There will be the stem cell injections, of course. There will be transcranial magnetic stimulation, where basically, like I said before, if, for instance, we want to focus on the fine motor skills in the hands, then we have a device where we can blast some magnetic wave into the very specific part of the brain that controls the hands. And we will basically stimulate the brain to have a response in the hands, basically. So we have all those therapies 3 or 4 hours every day, as you can see, from Monday to Saturday for 3 weeks. Regarding the stem cell injections, there will be 6 to 8 injections provided during the whole treatment protocol. Some of those injections will be provided through simple intravenous drip. So it lasts 30 minutes. The patients just sit or lie down and just wait for the injection to be done. It lasts 30 to 40 minutes. And we will also have some intrathecal injections. Those are spinal injections that are done in the back, in the spine, below the spinal cord. So there is no risk of any issue, basically. And we will basically remove a little bit of CSF, cerebral spinal fluid, and we will inject 2 milliliters of stem cell solution in there. The advantage of this type of injection is that it's like an highway to the brain and to the central nervous system. It's a more direct way to inject the stem cells to the central nervous system. So we have those 2 types of injections that we provide in combination during the treatment protocol, basically. So the patients will go through those 6 to 8 injections, all those therapies for 3 weeks. And at the end of the treatment, we have another consultation with the doctor, where basically we will summarize where the patient is at in terms of improvements and what has been provided during the 3 weeks. And we will also give guidance basically for the next year in terms of therapies. It means that basically the stem cell treatment, it's not for cerebral palsy, it is not a one-shot solution. It's not like we provide the treatment once and then the work is done. What needs to be done is that the patient, we recommend patients to keep doing at least physiotherapy and occupational therapy for at least 6 months and quite regularly every week, a few times a week. And the reason is that because when we inject the stem cells, those are living cells and they will start working immediately, but most of the effects of the cells may not show up directly. Most of it may actually show up in the few weeks or in the few months after the treatment. And in that specific time, this is actually the most important time to actually try to stimulate the patient as much as possible. So there is a feedback to the brain back and forth, basically. So this is our treatment. So it's quite a comprehensive treatment. I also forgot to mention that we have a nutrition therapy program on site. So basically on day one, there will be a blood test and we will check the weight of the patient. And based on this information, then there will be a consultation with the nutritionist and we will recommend a specific type of nutrition for the patient to make sure that he has all the nutrients that he needs and that maybe we get rid of harmful elements that he has in his blood. And we do all of that through nutrition, basically. The goal is that basically we want to give the best environment for the stem cells, the best environment as possible so they can thrive and do their best basically for the regeneration.
I'm just going to quickly summarize because I have some people who just joined. So we are talking about a very extensive protocol. I think it's the most extensive one that we saw in our group in the last year. It's a 3 weeks program. It has between 6 and 8 applications of stem cells derived either from placenta or umbilical cord or from cord blood, right?
So mostly these days, the stem cells will be mesenchymal stem cells from wharton jelly. So from umbilical
jelly, and as well stem cells derived from actual cord blood. And you divide it between IV applications and intrathecal applications, which you do underneath the roots of the cord.
Yes, it's the same procedure as for how is that called?
Epidural.
Thank you, epidural injection. Yeah, that are provided to pregnant women basically. So it's below the spinal cord level.
Okay, as well as very, very extensive physiotherapy and hydrotherapy. I think it's the most extensive protocol we've seen. You require a full medical file before the arrival of a patient. Now, how long will it take if, let's say, I have a patient that's willing to come today? How long will the procedure take until he will arrive physically to you?
So it depends on how long it takes for the patients to provide us with the information that we need, basically. So once the medical form is filled out, this takes 10 minutes. It's quite quick. In the medical form, you can upload medical reports if you want. But again, usually the doctors will check all the information that is mentioned, and there may be some information missing. Maybe we will need, for instance, a brain MRI or brain CT scan report that kind of confirms that this is cerebral palsy. We will need a medical report that states the condition history. When it happened, how it happened, why it happened, etc., etc. And if certain questions were not answered in the form, we will ask the patient again, basically, until we get all the answers. If we get all the answers, then the patient can be accepted very quickly. I mean, it could take as quick as 48 hours, basically. Once the patient is accepted, then we will send a confirmation acceptance email to the patient that will state what treatment protocol is recommended. And from there, the patient can register for the treatment. Then the quickest will be, I would say, 2 to 3 weeks to come for treatment. That would be the fastest.
So within 48 hours, a patient should receive a confirmation mail saying that we received your email, you received your information, these are the documents that are missing. And
yes.
Once the medical file is completed and the medical program is set, sometimes it takes about 3 weeks to a month to arrive to you.
Yeah, I mean, the patient could go, it could be quicker. I mean, it could be 1 week. The problem is that usually people need, to buy flight tickets and to get organized with their life at home. Maybe they need to take some holidays for the treatment because it's a long treatment. It's 3 weeks. So usually patients tend to arrive a few months after acceptance. But on our side, if we have availability, if there are rooms, the patients may come 2 weeks later, I would say.
Okay. Can you explain about the ages of the treatment? What is your youngest patient? How old is your oldest patient regarding CP?
Okay, so for CP specifically, the youngest patient will be 1 year old. We don't treat patients younger than 1 year old. So at 1 year old, we can start treating patients with the full program with intravenous injections and intrathecal injections. The oldest patient, there is no age limit really, but indeed, the older you are for CP, the less improvements you may see. Just because once the brain is not developing anymore, it's more complicated to get improvements, and it requires more work basically to get improvements. So we would recommend patients to come. It's hard to tell, but maybe before 15 years old. I mean, we even had patients, 16, 17 years old patients coming and having quite good improvements. So, I mean, it doesn't really mean anything, but in general, technically, the earlier, the better.
Okay, how about patients in their 20s and 30s and 40s? Because I have some patients like those.
So 40s, I don't think we've ever had a 40 years old CP patients. I think we've had some in their 30s, but very, very few. I would need to check the data. If we had some, it's probably like 2 or 3 in 15 years. Most of the patients are under 20. It's possible to get improvements because I think those people get improvements, and I can send the data later for this. You can give me an age, and I can tell you how many patients we had below that age, or like in a specific age range, and tell you if they got improvements or not. We have all the database with the improvements for all the patients for more than 10 years.
Can you explain a little bit about the source of the cells? Where you get them from? Are they supervised? By what government are they supervised?
Mm-hmm. So at the moment, the cells come from laboratory in Thailand. So it's supervised by, it's under the Thai FDA, basically. They come from umbilical cord that are gathered at healthy birth in Thailand. Those umbilical cords are gathered, are going to the lab. Once in the lab, basically, we extract the cells from the umbilical cord and we process them for about 3 weeks. Once processed, those cells are banked at minus 180 degrees Celsius. And basically that allows us to have a supply of cells for patients whenever a patient needs. So whenever a patient needs, basically the cells are taken out of the storage, they are being processed again for a few hours, and they are being released the day of the injection. So then they need to be injected within 12 hours.
Do you have a medical passport for each unit? How does it work?
Yes, we have a quality control report for each pack of cells that is provided to the patients. And those quality control reports will include data about safety and efficacy of the cells. So on the safety side, basically, we are following the international standards. There are international standards for mesenchymal stem cells, for instance, that tells you what you need to test in terms of safety and in terms of quality. So we are following those standards. So in terms of safety, basically, we are going to test for different diseases. Of course, the mother is tested even before we gather the cord to make sure that she has no disease, but then the cells are retested again. So in these quality control reports, you will see the results of all those tests. And then on the quality side, basically, we will check the viability of the cells, which means what's the percentage of cells that are alive and that are functional, that can actually work. We will check how many cells. We will check if the cells are really what they should be. It means that the nature of the cells, so we are going to check the markers on the surface of the cells to make sure that those cells are the cells that we need. And that's about it. We are basically following the ISCT standard, International Society for Cell Therapy. This is basically the international standard for umbilical cord-derived stem cell treatments.
How many cells do you give per kilo?
So so the rule would be 1 million kilogram per kilograms, but because we provide large amount of cells, we tend to not go, it could be more, but we tend to, especially for children, we tend to not go beyond 20 million cells per injection. And we repeat injections, like I said. So we go 6 to 8 injections. Yes.
And you will see a better result with giving a lot of smaller doses than one big dose, because let's say in most protocols, we see that they give maybe 2 injections of 3 million, 3 to 6 million cells a kilo. Now we've encountered maybe another program like yours. There is a Polish program very similar to the amount of cells you are discussing with us right now that are also giving small amounts per kilo, and they give it within 6 weeks. So 6 weeks apart, they give 10 injections. I've seen quite a few programs, and I'm very curious to know, why did you choose to give a big amount of injections, but small amount of cells per injection?
So I'm not specifically a doctor, but back in the days, we were told basically that somehow the body needs to be able to process and absorb those cells, and that they were preferring giving multiple small doses of injection instead of a large injection that may be wasted. And also maybe if you inject a lot of cells at once, a very large amount, there may be also more reaction from the immune system because the cells are coming from donors. They are not the patient cells. So those cells basically, even though they have low immunogenicity, which means that the immune system doesn't really pick up on them. I mean, it picks them up, but not as fast as it should be. If you inject a large amount of doses, I guess there's also more chances that the immune system will pick up some cells and just kill those cells. So we prefer to go slower and to go smaller quantities, but multiple injections basically, and give time to the body to process those cells. Also because these cells are not the patient cells, the mechanism through which the regeneration happens is slightly different than if you were injecting the whole patient cells into the patient. Basically, if we were gathering the cells from the patient and providing them to the patient, the mechanism would not be the same, because the cells from the patients are 100% compatible with the patient, right? So what will happen with our cells is that basically our cells, we inject them, then there will be, like every stem cells, they will be attracted to the site of injury. And once they are on site, basically they will work through a mechanism that is called paracrine signaling. This paracrine, so because people believe that the only job of stem cells is just to differentiate into other types of cells and to basically provide regeneration through direct differentiation, but this is actually not true. It's only one part of their work. The largest part is actually done through paracrine signaling. Paracrine signaling means that the cells are now in the injury environment and they can sense the environment and they see that something is wrong basically. And what they are going to do is that they are going to release cytokines and other factors that are going to basically stimulate the own patient cells, the immune system and the own patient cells. They are going to recruit cells from the patient's body, basically. And then it's like a snowball effect, basically. So my point is the first stem cells are not going to do the work 100% on their own. They are going to activate the regeneration, basically. And then this is something that will be ongoing for the next maybe 6, 9, 12 months after the treatment, even though the first cells, they're actually already dead. So those are the different reasons why we do it slower. And we believe that this is better. I know that some clinics provide very high amounts in very short time. And we don't like doing this, to be honest.
Okay. I have one more question before we're going to open the floor for people to ask questions and move on to the next subject. How long should it be between treatments? So we've done this treatment, it's 3 weeks, it's very extensive. Child goes home. What happens when the parents want to return? How long do you think it should be between treatments?
Okay, so well, first of all, yeah, depending on the families, some families may feel like the improvements that they got after the first treatment was enough for them, and some of them don't feel the need to come back. For the ones who feel like they need to come back, because the improvements are usually, I mean, 99% of the time for cerebral palsy, the improvements are forever, right? So the improvements that you gain from the treatment will last. If the family feels like the improvements reached a threshold and the patient is not able to go beyond through conventional therapies, then we would recommend, it really depends on the situation. Usually after 9 to 12 months, families tend to tell us that, okay, now the improvements are stable and it's much, much slower than before. Then that may be the time to come back. It could be between 6, 9, 12 months about.
Okay.
But I would like to mention something. The thing is that when you get these stem cell treatments, what will happen is because the brain is developing some new potential, the patients through conventional therapies will be able to go beyond what they could do before. So basically before the treatment, if a child was doing a lot of occupational therapy to try to use his hand and grab a cup and he couldn't do it. After stem cell treatment, maybe he sees that is improving and now you can start grabbing light and smaller objects. But even maybe after 9, 12 months, after the cells have completely done their job, the brain has been restored to some extent. And so basically now he's able to work further and do more occupational therapy at home, and he can keep improving over the years. So we also have, so every single situation is different, but we also have patients who came once for the full treatment and then decided to just keep going and maybe come back sometimes only for therapies, for instance. Or just stay at home and do extensive therapies every week for the next few years. And maybe after a few years, they really feel, okay, now our child really doesn't improve anymore. Now maybe we need another injection. So each family will see basically how are the improvements and when they should come. And then they can contact us and we can see together.
Okay, I would like to open up the floor for questions about what we just spoke. And then afterwards, we'll continue discussing the next cases. יש מישהו שרוצה לשאול שאלה בינתיים? חברים, כן, לא? אוקיי. אוקיי, I think it was quite clear. זה היה ברור פה לאנשים? אתם יכולים קצת לתת לי פידבק? היה ברור לכם מה שהוא אמר? לא היה ברור? אתם יכולים לכתוב למטה?
So, also I would like to mention something, if there is no question, is that the treatment that we provide, it not only can help the patient through the treatment itself, but it will also be some kind of training sessions for the parents, because there will be so many therapies that will be provided, and the parents will, they are allowed, of course, to be there during the therapies. The therapies are one-on-one, by the way, or even one patient and two physiotherapists or occupational therapists sometimes, depending on the needs. So they will see the exercise that needs to be done once they are back home, and what kind of things need to be changed maybe in their lifestyle for the benefit of the child. So it's not only helping through the treatment itself, but also it's also a training session where the parents will have a better idea of what should be done in the future, basically, and what they should keep doing.
I would like you to explain a little bit about the different conditions you treat with children, because I know you do treat a lot of different conditions regarding children. If you can just give us the headlines, what kind of conditions you treat, and then we will take a little tour with adults because we have half an hour. So if you can just explain first about children. Okay.
So for children, so CP is the condition that we treat the most. We have spina bifida. Spina bifida is basically when children are born with the spinal cord basically getting out of the spine. So usually those children, they get a surgery at birth, and sometimes it's also pulling on the spinal cord, and so it creates hydrocephalus, which is like very high pressure around the brain in the skull. And so basically those patients are like CP, basically. They also have a neurological damage from birth. So we treat those patients as well. We also treat children with a condition called ONH-SOD, optic nerve hypoplasia or septo-optic dysplasia. Those are children who were born with a underdeveloped optic nerve. So the optic nerve, which is the nerve that goes from the eye to the brain, which is bringing the information from the retina to the brain, is underdeveloped. And because of this, basically, even though the eye is functioning and their brain is functioning, the cable is too thin to bring the information, basically. And so we provide stem cells to help this nerve to grow. And so information can go through in an easier way. And so those children basically start to see things that they could never see before. We also have autism. For autism, it's more of a 2 weeks treatment. Of course, there is no physiotherapy, occupational therapy, but still there is nutrition, stem cells, there is acupuncture, there is transcranial magnetic stimulation. For autism, we also used to have a therapy that we don't have available right now, but we are trying to have it back. Because of COVID, we have some logistics issue with that therapy, which is called fecal microbiota transplant for autism. So because autism children, we found out, I mean, science found that basically they have their gut bacteria, the gut flora, basically is not balanced like in normal people, normal individuals. And so through that therapy, we try to rebalance the gut flora. And so that may provide those patients with improvements in terms of bowel movement, because a lot of autism patients are really constipated because of that as well. And it also brings some neurological improvements, but it's not available at the moment. So autism. Then we have, what else? We have SMA, spinal muscular atrophy, which is a genetic condition. There are 3 types, type 1, type 2, type 3. We don't treat type 1 because this is the more severe type and we don't treat it very well. We tend to focus more on type 2 and type 3. For those specific conditions, for SMA, the improvements are not permanent, just like CP, because the condition is a genetic one, and it's even though we restore some of the brain function, the disease is always free to keep attacking the brain. So at some point in their life, I mean, the condition is going to get worse again, and so then the children have to come back again. But we can help with SMA.
So children, SMA, it's not permanent, but CP is permanent.
Yes, CP, spina bifida, ONHSOD, autism, all of this is permanent.
We spoke about drowning. We spoke in our previous conversation, we spoke about drowning victims. So children or adults who had drowned, and you said that you also treat children like that.
Yes, for children we can. So it's like it's more considered as some traumatic brain injury, I guess. So we can treat children with these kind of conditions. The thing is, for this type of condition specifically, the time between the injury and the treatment will be more important than for CP. For some reason. So for this type of condition, we can treat patients, but it's quite important that they really come as soon as they can, basically, that they don't wait too long.
Is it the same with other brain injuries like brain bleed and stroke?
Yes,
something that's time sensitive?
So if the brain injury, the stroke happened like very quickly after birth, this is still considered as CP. And for us, it's because it happened very early, the patients have still a long way to go in their brain development. And it's, I feel like it's easier for us to treat. But we haven't treated so much children with who drowned, for instance. I will need to find the data to give you more data about this specifically, but traumatic brain injuries mostly for us it's more adults.
Okay. למישהו יש שאלות על ילדים או שאנחנו יכולים לעבור למבוגרים? Okay. I think we will take a little walk down adult lane and speak a little bit about adults. We do have some adults in the audience that have their own medical issues. I would like to discuss heart attacks, brain stroke. Car injuries, and some orthopedic conditions, maybe. And I think these will be our main focuses. Of course, in the future, if there's going to be questions that will arise, I will ask for you to give us an answer via email. Oh, we were asked about Sheehan syndrome. We have a patient in the crowd with Sheehan syndrome.
Oh,
So
I personally don't know about this specific syndrome.
So
sorry?
Sheehan syndrome is where the hypophysa is being hurt during child labor.
No, I see.
Gland.
Okay, I would need to check with the doctors. I don't know about that one. I can contact the doctors and give an answer later.
I will ask this patient to contact you directly for your medical advice.
Yes, the doctor would have to review this one. I don't think we have much experience for that one specifically. Regarding a stroke, for instance, it is, so first of all, I mean, beyond the therapies that these patients got after their stroke, there's nothing much in their country, right? So it makes sense to provide stem cell treatment to try to regenerate the cerebral function to some extent. However, you have to understand it's much more complicated to treat than, for instance, cerebral palsy, because most of those patients, first of all, are adults. Unless it's a stroke that happened, like I said, like quickly after birth, we have some of those, and then it's considered a CP and it's completely different. But an adult stroke should be really treated as quick as possible. And there will be a lot of efforts needed from the patients to gain as much improvement as possible. Like I said, it's not only going to come from the stem cells, but also from all those other therapies. And some of them will have, if the patient wants to have the best chances possible, the patient will really have to do a lot of efforts and after the treatment. Get some oxygen therapy, gets a lot of PT and OT. It's really necessary. It is, those patients can get improvements from the treatment. It is just not as easy. That's what patients need to understand. It's not a magic trick, basically. This is something that can definitely help, but a lot of efforts are required. Let me pull some. Let me try to put some data.
Meanwhile, one of the parents asked a question. This is about a CP child. He got, I will just a second. This is a baby that was born while the mother had COVID. The mother was sick and was on inhalation during, she was ventilated during pregnancy. And this child was born with a condition and he ended up having CP because of his mother's condition and the fact that he also contracted congenital COVID. And he has a very difficult situation with the CP, and the parents are asking if you have any experience with children like this, which you might have.
So, to be honest, the cause of CP, it doesn't really matter for us. It means that we don't. First of all, it's very hard to have data about because CP. There is like 100 different reasons why you may have CP. And it could be any kind of injection during the mother pregnancy. It could be the umbilical cord that was wrapped around, the neck when at delivery, so there was a lack of oxygen. It could be because of jaundice. There are so many different reasons, and also there are so many ways in which the patient can be affected depending on the part of the brain that is affected. So every single patient is different, but for us, we treat all patients affected with CP. The reason doesn't really matter. What will matter the most is the severity of the symptoms. Obviously, the more the symptoms are severe, the more complicated it will be. I mean, the longer the way is basically to get back to,
better function.
To a better function. So if a patient, for instance, cannot hold his head, cannot walk obviously, but cannot hold his head, cannot sit, cannot use his hands at all, is swallowing. Some cannot even see, some are blind. Then it's going to be more complicated, right? So maybe we may get the child to better hold his head. Maybe we may get the child to better sit and to start slightly moving his fingers. If a patient can already move his fingers a little bit, then we may go to the next level. So this is what is important for us. And the age of the patient, obviously. If the patient is 35 years old, it's going to be much more complicated than if he's 6 years old, for instance.
And,
so,
and again, age matters. So if I have a 2-year-old versus a 6-year-old, there is a difference in the result?
So again, it's hard to tell. In our data, we don't really see, and maybe that's because of the way that we gather the data, but we don't really see a difference. It means that a 2-year-old and a 6-year-old can get equal amount of improvements. But the thing is that in CP specifically, because those children are growing constantly, if the treatment is provided at a later stage, you know, let's say the child is 12 years old or 6 years old or 8 years old, is growing already. And so his posture is not right. And so the way he's growing is not right. And so that may bring extra complications, basically.
So yes,
that are secondary, that are, yes, because if you treat a 1-year-old, you may be able to prevent issues in the way the child grows, because his muscles are going to be strengthened. He will be able to sit straight, maybe to hold his head straight. And so he will, when he grows better, basically. Some children, I know that they have surgeries, you know, for instance, they need to break the hips or the knees because it didn't grow straight. And then when they want to come for treatment, basically, we want them to be in the best shape possible before they get the treatment, basically. If the goal is for the child to be able to walk with canes, for instance, first of all, he needs to have his hips and his knees, and you know, everything needs to be in line to not, of course. So that's why it's always better to treat the children earlier. It doesn't mean that a 6 or 8 or 12 years old will not get improvements. That's not what I'm saying, but it's just that because they grew already, and that may have affected their posture and their bone structure, it's just more complicated.
Okay, so you recommend for patients in this condition to do the orthopedic surgery first, do the rehabilitation, and then come for the remainder of the treatment.
So yes, if it's really like a big issue, meaning the patients would never be able to work if we don't strengthen and everything, basically, then the surgery, we would recommend him to have the surgery first, recover first, and then to come for stem cell treatment. Okay.
I would like to ask a question about epilepsy, if it's possible.
Yes. So epilepsy, there are a few things about epilepsy. One is that we don't treat patients who have an epilepsy that is too severe, and that is subject to the opinion of the doctors about each patient. But if a patient has, I don't know, like 15 seizures a day, and they all last 2 minutes, we will ask the patients basically to really try to control it as best as possible to reduce the epilepsy before coming for treatment. And the reason is that actually stem cells can help for epilepsy. We had patients coming with CP, and one of the symptoms was epilepsy. And the epilepsy in the next few months after the treatment got much better. It may disappear completely if it was light, or it may just become much more mild. And maybe the patient doesn't need to take as much medication as before. However, there is one thing, is that stem cell treatment may make the epilepsy worse in the first few days to few weeks after the treatment. And that's a temporary issue. And that's related to the fact that stem cells improve the signaling in the brain. And so for some reason, basically, and for some patients, it's not everyone, but for some patients, the epilepsy, the seizures get worse. It may last few days, it may last few weeks. And then it goes back to where it was before, and then it even can improve until maybe there is no epilepsy or the situation is much better than before. We cannot, like for any symptoms, we cannot guarantee. For instance, if a patient comes with multiple symptoms, maybe the patient has epilepsy and has fine motor skill issues, we cannot tell you, okay, the fine motor skill issues are going to be treated, but not the epilepsy, or the epilepsy is going to be treated, but not the fine motor skill issues. The stem cells anyway are all going to the central nervous system, then it's really up to them. So some patients will get improvements for epilepsy, and some will not, and will get improvements in some other areas. Some patients may get improvements for epilepsy after the second treatment as well.
I would like to ask about diabetes. This was a very common question in our group, type 1 and type 2. What is the effect?
So diabetes is so far quite complicated to treat because there is an underlying condition. So the stem cells may be able to help the body to maybe regenerate some they call it Langerhans islets, I think, for yes. Diabetes type 1. Yes. Some new ones and that are not affected. But the problem is that this condition, to some extent, both of them actually, some people say that diabetes type 2 is not, but it actually is to some extent, are some kind of autoimmune condition. And the mechanism is not the same for both. But so because this autoimmune condition is underlying, and so that's the same problem as for genetic conditions, that with the stem cell treatment, we can only help temporarily. The blood sugar may get lower for some time, but after some time, it may get back to the previous state, basically. So stem cell treatment is not enough unless you come once and get improvements and then come regularly.
So this will be a chronic condition, a chronic treatment for these patients.
Yes, patients. It's a treatment that has, if it's only stem cells, the treatment has to be repeated several times to control the blood sugar, basically.
Okay, we have a question here from the audience. It's about stroke. She's asking if there could be a worsening in the beginning and after a few months, an improvement with the patient's skills.
A worsening in terms of what? Of symptoms after the treatment?
I will ask. שרה, את יכולה להיות יותר ספציפית לגבי השאלה שלך, שיוכל לענות?
אני אגיד לך מה, אני ניסיתי לשאול כאילו על המצב שלי, הגבלתי את זה לשבץ.
זה סוג של שבץ.
כן, אז...
זה סוג של שבץ.
כן, אז השאלה היא האם יכולים, אצלי ספציפית, כאילו היה הורמון אחד, את ראית שירד. השאלה היא האם זה יכול להיות קשור לטיפול, כאילו אם יש החמרה, אבל רק לאחר מכן שיפור.
Okay, so in this particular case, this is a patient with Sheehan syndrome. So this is a stroke of the hypophyseal gland. So she's treated like a stroke patient. And the area that was damaged is the hypophyseal gland where you manufacture some hormones. And she's asking if the hormone levels can become worse and then after a few months can become better. She's done stem cell treatment she had a worsening in the amount of production of or disproduction of that particular hormone. And can it get better after 2 months?
I don't know. I'm sorry. I would need to ask that's very specific. I would need to ask our doctors. If that person wants, she can always fill out a medical form and ask the questions she wants to ask. Filling the medical form doesn't mean that the patient needs to get our treatment, not at all. I can go and ask the doctors here, see what's their opinion about that very specific issue.
Okay, קיבלת תשובה?
We have
the medical form.
Yes.
Sorry, this is Chagai. The medical form is you sent it to me to share with anybody who wants to contact you. Okay.
Yes, you want me to.
Of course, they can contact you directly to get it.
Yes, you want me to put the link to the medical form here?
No problem. Okay, great.
I'll do it. Okay.
I have it. I'll share it in the Facebook group or anybody that sends me a message.
Okay.
The last question will be about autoimmune diseases. So we had some questions from patients with lupus and Crohn's disease, the two different autoimmune conditions. And I think with that, we will finish. The same patient is asking about Hashimoto disease that was caused by the same problem, if that can also be affected.
Yes, so that will be, okay, that will be the same answer as for diabetes and as for genetic conditions. And all those conditions have an underlying cause, which is a dysfunction. So in those specific cases, dysfunction of the immune system. If we can't fix the way that the immune system works, basically, then the improvements will only be temporary, unfortunately. Now, I would recommend again, maybe these patients to also look into FMT, which again, we don't provide at the moment, we used to provide it, because, and I'm not saying that it's gonna work or it's gonna be a solution. I am not sure about it, but there's been a lot of research and studies those past few years for all those conditions that you mentioned. And I saw papers for all of them actually. And they all have gut microbiota dysbiosis, meaning that the gut flora is imbalanced. There are specific types of bacteria in your gut, and you have, if I'm not wrong, 700 to 1,000 different types in your guts. And the profile of the gut bacteria community is different from healthy people. And so I know that there's been a lot of studies about this. And what I'm trying to say is that now the scientific community is trying to figure out if all those autoimmune conditions, one of the reasons why the autoimmune condition is there in the first place may be in the gut. The solution may be in the gut. They don't know, I mean, at least I don't know, we don't know if it's the cause of the effect, basically. So I would recommend those patients to look into this. It's called FMT, fecal microbiota transplant. What they do is that they take the gut bacteria, the whole ecosystem of a healthy individual through their fecal matter. They put it in capsules, or they provide it through enema, by rectal way, and they try to influence basically the making of the gut microbiome. So to change the population basically to a more standard population, which may potentially help those patients to actually reduce their symptoms. I would recommend them to look into it.
Okay.
I'm not an expert. I'm just saying that we've seen that before, and we've been providing FMT actually for few conditions in the past, in addition to stem cells, because again,
they're linked.
We are not here to provide one one specific treatment. It's not that we like to provide stem cell treatments only. We are trying to provide all the therapies that may help for a specific condition. And so when we had FMT available, we were treating patients with stem cells plus FMT for autism, for a condition called PLS, primary lateral sclerosis, which is a condition that is like ALS. ALS is a neurodegenerative condition that is very tough. Very severe. PLS is a lighter version of ALS. And actually, just to give you an example of patients who had PLS, who came and got the treatment. I have one patient who got stem cells and all the therapies that I mentioned before. The first time, the second time came back and got stem cells plus FMT. And when she got FMT, within a few days, she found like she had more energy and she could go to the bathroom, like to the toilets. She had normal bowel movements again. And so that helped her a lot. And that was in addition to stem cells. So I would recommend those patients. Again, stem cells can help, but only temporary. That therapy may be able to provide further help for this specific type of patients who have autoimmune conditions.
Okay. This is, I'm afraid, all the time we have left for today. So, מישהו רוצה לשאול עוד משהו אחרון לפני שאנחנו סוגרים?
So I'm going to share right now, 1 second, the link to the medical form. I'll just copy this.
We will also attach it to your video.
Okay.
Great.
Here it is. So people can click on this link and fill out the form, and at least we'll do our best to give you as much information as possible. Then patients are free to receive the treatment or not. It's not an issue.
Wonderful. So thank you very much for coming today and providing us with this information. It was a very, very good lecture. And we will speak later on about what we could do and what kind of programs we can share with the group. If nobody else has something to say, thank you, and we will say goodbye now.
Thank you very much.
Very well.
Thank you. Bye-bye.
Bye-bye.
Bye-bye.